this Nati Vaidya aspect of things, where you said 8 out of 10 are not done properly. This is that's jaw dropping, right? Like I was in Jayanagar, and there was this guy with extreme speech impediment, and he was in his 20s, and I was asking him, have you shown it to a speech therapist? Have you had some kind of corrective therapy done? And then he mentioned to me the same sort of thing. He's been to Nati Vaidya, they've done a bunch of Ayurvedic things. It hasn't really worked. Do you have any like solutions or intuitions about what we could do about that sort of thing? Because that, I mean, in the big picture, that is going to always impede us as a country, like as far as living healthy, being healthy, having better outcomes in life and things like that. And I understand folks in the villages, and people can't afford some of these surgeries. They can't afford to come to big hospitals and so forth, so they do it for that reason. And then there's a distrust of Western medicine, quote unquote Western medicine, and stuff like that. I'm sure you've thought about this.
Yeah, I think so I can sum all the whole thing in one word called health illiteracy. So in India, I think health illiteracy is a very big problem, maybe 80-90%. Even educated people, even people who have qualified, done BSc, MSc, BE, so many things,
Wow.
law, everything. It surprises me. It really surprises me because
Yeah.
reason is very, very logical, very, very, 2 plus 2 is 4, that kind of a thing, really. And now we have got evidence-based medicine. You can, if you're really good, you can Google it or PubMed and find exactly what is the treatment, what is the stage, is it stage 1, orthopedic, 2, 3, 4. For each one, there is a definite clear-cut guidelines, and there's no confusion. Okay. So having said that, still, our country, around 90-95% is filled with health illiteracy. That's why they run to this one. And it's not just about the village people who run. Even educated people run,
Sure.
I'm really surprised. Sometimes patients do come to me and they come and say, sir, I want to go to this Nati Vaidya in Mysore who treats my neck pain. And please write down, write down a prescription for the neck x-ray, because my Nati Vaidya, who's basically a quack, is busy, okay, because he sees 100 patients a day and charges 1,000 rupees per patient, okay, and he doesn't have time to do a form for my x-rays. But I, as a super specialist, should sit here and do a form for him and charge 500 rupees, and he calls me as a looter. You understand where I'm coming from?
Yes.
Quack in Mysore, pay him 1,000 rupees, wait whole day, okay, get treatment, and rather than come to a specialist and get it treated. This is, if I don't call it as health illiteracy, I can't call it as anything else. Okay, this is what. Okay, but there are several reasons for that. As you mentioned, quite a few things. The problem is, again, comes back to leadership, because the role of the leadership is to understand, okay, what is our population? So we are the largest populated country in the world. Okay, what are the common diseases that we have? Which area of the country has got these diseases? So what is the kind of skill set we need for this area, say Assam, Kerala, or Bangalore, or Karnataka? How many doctors should we produce logically for this disease? Somewhere too much of cancer is there in Kashmir, Kangri cancer or something like that. How many cancer specialists do we need in Kashmir? Okay, in 5 years, 10 years. This is how healthcare is planned in the developed country. None of that happens in India. It's very, very ad hoc, very, very, they don't have a vision. Oh, I'm here for 5 years. How much money I can make in 5 years and go.